Hi, this is my week 1 video journal. So my clinical experiences so far in the program, I worked with my first term with a therapist and learned a lot about different psychotherapy modalities, CBT, DBT, psychodynamic, and it was very good introduction, very helpful. And then my second clinical, I worked with a psych nurse practitioner who did her own outpatient private practice, and she saw all ages, pediatrics to older adults, and it was very eye-opening. She did therapy and med management, which was really interesting. The reason I chose to work with this population, I'm a family nurse practitioner. I've been a FNP for 2 years, and the biggest thing that led me into wanting to do the psych program was that a lot of my patients would come with mental health concerns, or they would come with physical symptoms, but after kind of going through everything and doing a full assessment, come to find out that it's most likely, a mental health issue that's manifesting itself in some sort of physical symptom. And I was referring a lot of patients out and finding out that it was like a 3, 4, 5 month wait to see a psychiatrist, which can be very frustrating. And just seeing the need that these patients have and wanting to help. And sorry, my computer just closed. Okay, the next question. Discuss any concerns I have regarding this specific clinical course. So this is obviously the pediatric clinical, and the only, I don't know if it would be, I guess my main concerns would be I want to be more familiar with what medications are more appropriate for a pediatric patient, and more familiar with the dosages, and also I don't know if this would qualify as a concern, but I've just come to realize how many, I was a little blind to how many people have been exposed to childhood trauma and just all these awful circumstances in childhood. And so just being more aware of how common it is, and trying my best to be a part of the solution for that. And identify personal academic goals. I want to become more familiar with the medications like I talked about earlier. And I want to be more comfortable with communicating with especially adolescents. I have 2 children, so I feel like young children, so I feel like I'm fine with the younger ages, but adolescents can sometimes be challenging to get through to them or get them motivated, or get them to open up and be honest. So that would be nice to get more experience with that. And what strengths, weaknesses. So yeah, kind of what I already talked about. My weaknesses would probably be just I need to get more experience communicating with the adolescent population, more experience with managing the medications. My strengths are that I've got quite a bit of nursing experience, and then I've gone through the FNP program, so that's really been helpful. And I have some experience with diagnosing and prescribing with that, so that takes a little bit of the pressure off. And I'm excited to learn more throughout this course. Thank you.